All right, let's talk about what AAP grading is. So if a patient has periodontitis only, we are going to give them what's called a stage. We talked about it earlier, and then a grade. So a grade helps measure the rate of progression of the patient's teeth. What it says is, for the patient's age, are they going to be able to keep their teeth for their lifetime? So if I have a patient who is maybe 15 and they already have 20% bone loss, I'm concerned that they're not going to be able to keep those teeth for their lifetime. So that's what this table helps us determine. There are a few factors that we can give a patient either a grade A, a B, or a C. So generally we're going to start at a B. We're going to either shift up or shift down depending on how well the patient is doing. Some of the modifiers instantly that you might know and be able to assign a grade for is if the patient is a smoker or they have diabetes. If they smoke a pack of cigarettes a day, we're concerned. They're at a C. If they don't smoke at all, we might be leaning more towards that A, but we also have to determine how much bone loss they might have. But if they smoke a half a pack a day, they're at a B. If they have diabetes that is uncontrolled, they're at a C. If they're in, that less than 7% range, or if it's normal, they're at a B or an A. Now, if they have no problems with smoking or diabetes, and they do have periodontitis, then the category that I go to is the bone loss divided by age category. So the bone loss divided by age category here, you'll see, is if they are in that 25 to 1 range, they're a B. If they're 1 and above, they're a C. And if they're below 20.25, they're an A. Now, doing math is kind of tricky sometimes, but how to do this math exactly when you type it into a calculator, you find the greatest area of bone loss that the patient has. Let's say it's 20% on tooth number 15, 20, and you divide that by their age. Divided by 60, this patient is 60. So I get 0.33. So they fall under grade B is where they'd fall. Now I've put in, for example, down here, all of the ages on the left side that patients could be, age 15 to 100. And then along the top, the amount of bone loss, the percent of bone loss that the patient has. So you already know this. This is pretty easy to guesstimate even in your head if you didn't have a lot of time to sit and do math. For example, if you have a patient who is age 19 and they have 30% bone loss, does that concern you? Are you concerned that their teeth might not last them their lifetime? What about if they're 90 and they have a little bit of bone loss? Are we concerned that their teeth aren't going to last them their lifetime? No, I'm thinking their teeth are going to last them. But if they're age, like say 40, and they have 25% bone loss, I am concerned for them. But hopefully they're going to be able to keep their teeth for their lifetime if they, do their periodontal maintenance and come in and see you for their care. So that's how grading works. It's nice to see that table, to know, where the patients might land based on their age. And that's how you can get the grade for patients who have periodontitis. If a patient doesn't have periodontitis, they don't receive a grade.